If there's anything more important than keeping up with the Joneses, it's making sure that your kids can keep up with the Joneses' kids. Or better yet, surpass them in every athletic, scholastic, and social event in the neighborhood. The problem is, not all kids develop at the same rate. How do you know what is normal in the way of varying child development?
We see them right from newborn. In fact, we even do a prenatal visit for new parents. We see them from newborns through high school, essentially. Most of our patients now graduate from 18 and we do their pre-college exam and then pass them on to our adult colleagues.
From day one, your pediatrician can be your best ally in making sure that Junior is developing at the right pace and getting the appropriate checkups at the right ages, especially if you're new to this world of booster shots and boo-boos.
We will follow development along with you, and there are some guides that we can give parents. In fact, we even give them handouts at that first visit about what to expect at what time in a child's life as far as development goes. Most development, especially motor development, occurs basically from head down to toe. So children gain control of their smile, they gain control of their neck, then they gain control of their upper trunk with the ability to push themselves up into first just a leaning position, then into a full sitting position. They'll, at that point, also be getting themselves the ability to go from one side to the other.
Although we normally get excited over the physical developments we see in our kids, there are changes in other areas to anticipate too.
The other important skills are, of course, social developmental skills and language skills. Children become interactive early in life. By 4 months of age, they're not just takers, they're givers too. They start to make playful squeals to get your attention. They show signs of pleasure when you give them attention. Those are very important milestones that some parents don't even realize to look for. In fact, it's actually the younger kids in the house that pick those up. That's when the siblings start to have fun with the baby because they notice that the baby enjoys their presence. And then, of course, language skills. Babies are making noises from day one. They're unfortunately usually cries at first, but those cries get to be more and more specific, and by the second half of the first year, by 6 to 9 months, they're making specific sounds, and gradually between 9 and 12 months, they're starting to put those together into their initial words.
And if Junior is one of those kids who picks up on things quickly, I mean, maybe he can throw a ball halfway across the room and ask you to please pass the potatoes at 7 months of age, don't be so quick to fill all his time with flashcards and piano lessons.
It's absolutely true. Kids' play is children's work, and they have to have that free time. They have to be allowed to set their own areas of interest. They have to be able to discover what their own strengths and weaknesses are, and they have to learn how to relate with other kids on their own, not have scheduled play dates. Not that there's anything wrong with getting your kid together with your friend's kid. That's great, but when that becomes their total social life, then they no longer know how to negotiate those things themselves, or they won't learn how to negotiate those things themselves.
While watching all the wonderful and inspiring changes in your baby over the first year of life, don't forget to also enjoy and appreciate those miraculous firsts. You'll never get those years back, unless you pop out another one. I'm Dr. Keller Wortham, and you're watching the eHealth Network. We'll see you next time.